I'd like to hand over to Dr. Juping Yu. So just as by way of an introduction, Dr. Yu is an assistant professor at University of South Wales. Dr. Yu led on a piece of work kindly supported by some funding from University of South Wales and overseen by Professor Wallace. This was to create some intelligent information for how we could be delivering services better locally. And I think was a great innovative example of how we could be recruiting volunteers in the community to be facilitating lay research focus groups. And there should be lessons both for our services locally in east of Newport, as well as around Wales and the rest of the country. Over to you, Dr. Yu.
Thank you. Let me share the screen. Good afternoon, everyone. So in this presentation, I'm going to talk about the small pilot work we conducted last year to test the feasibility of engaging community members to inform the development of the Nightingale Hills Health and Wellbeing Center. I'm going to cover 4 areas: sample and recruitment, the data collection, some of the key findings, and lastly, the lessons we learned from undertaking this work. The sample and recruitment. The participants were recruited between March and July 2024 last year. A purposive sample was used. Participants were recruited from community members who were willing to take part, who lived in the Ringland or Alway, were willing to share their lived experiences and expertise in a small group, or they were willing to be trained to engage local residents to gain their views as a community-based researchers. So recruitment information was circulated by relevant networks and local community centers through word of mouth and emails. So in total, 21 participants were recruited. So these included 3 community-based researchers. So the participants, the age range were ranged between 18 to 20 and 71 to 80, but the majority of the participants were aged in their 50s, 60s, and 30s. 12 participants were female and 9 were male. 19 participants were white and 2 were Bangladesh. So of the 21 participants, 14 participants reported no disability, and the remaining 7 reported at least one health or medical condition. Regarding the data collection, so 3 focus groups were undertaken. So each focus group was facilitated by a community-based researcher. Focus group 1 had 2 participants. Focus group 2 had 5 participants. And focus group 3 had 10 participants. Also, 1 interview was undertaken with a non-English speaker. A topic guide was developed to inform the discussion. 2 broad questions were developed for the discussion. How would the center work best for local residents, and how could local residents benefit most from the center? These are the 2 broad questions we discussed. In addition to the list of services planned to be delivered in the center, participants recommended some additional medical services, such as in-house pharmacy, minor injury care unit, and an X-ray department. For example, a participant said, I think the pharmacy would be good in there as well, because like a lot of older generation, they have to go to like a local shopping center to get their medication. And obviously, Ringland East, I think, is getting closed now. So the nearest one is probably Alway. But like people who are disabled, they can't travel. Another participant reported, perhaps services like, instead of going to the hospital for sutures being removed, different little things like that. Could they do in the surgery? Some participants recommended an extra department should be included in this super duper hub so that patients wouldn't be waiting for the X-ray and the results in hospital. Some additional facilities were recommended to promote the health and well-being. It was noted such facilities should be age-specific to address the needs of people in different age groups. For children, a kids' play area and a tuck shop or a vendor machine were recommended. As they said, if they wanted to, like keep children happy, like maybe have a tuck machine or a vending machine or something like that to keep the children quiet. For younger people, a youth club and a football team for boys were recommended. For space, for recreation and leisure, I would have thought that would have been something to do with football and outdoor. Then for older people, a cafe shop was suggested, as they believed, because older generation, they like to socialize, but the only way they socialize is going to the cafe and have a cup of tea. Then for people with language barriers, language classes and bilingual groups were highly recommended. Then participants reported their expectations for the services. First, shorter waiting times were expected. As a participant reported, we go to doctors a lot with our children, so waiting time is quite annoying. And I just went to service, and obviously it's not just for me, for my kids and their future as well. Participants discussed their expectations on the environment where services are to be provided. A nice, friendly, and inclusive environment was highlighted, where participants are treated with respect, not like you are second citizen. Cultural competence of staff was considered essential because, as a participant said, I would want the staff to be more considerate, as it may take me longer than English-speaking people to understand things and then answer back. Then patient privacy was expected. As a participant reported, I think there should be a room, a service that could go into to say why you want to see the doctor for reasons, rather than stand in front of a screen and the whole surgery is listening to you. So everybody is listening to what you've got to say. And that's the biggest thing, more privacy. Then there are some expectations for patients. Patients are expected to behave properly regarding the use of mobile phones, abusive language behaviors, and turning up to appointments. For example, a participant reported, even mobile phones should be banned too. Half of them are swearing this, that, and the other. You don't want to sit there and listening to that. And another participant reported, if somebody gets abusive and is swearing and is behaving badly, out. Go and find another practice or go somewhere else. So many participants were annoyed with people not turning up to their appointments and suggested a 2 strikes and out rule. For example, a participant said, I think there should be a 2 strikes and out. That if you don't turn up for appointment twice, and here you go, and that has an effect. Or say in a certain, well, no, 2 strikes and you are out. You won't find another medical practice. Participants also made recommendations for community engagement. When being asked what could be done to make the new center lively, some participants referred to the center as a community center. There should be an area for children, having facilities for people of all ages, interests, and backgrounds. There should be an area for children to play. If they got to have a community center, you've got to have bingo nights, themed nights, barbecues, etc. Like summer balls, and if they are going to have a community center, things like that. Participants also believed getting their bearing of the new center to help them to get the bearing would help promote the initial community engagement. As a participant said, well, why not have an open day on a Saturday and when they are closed? I know it's really hard, but yeah, you can have an open day then. I was just thinking they could do it like an induction day for when you go from the primary school to the high school. They also believed that having the opportunity to be listened to and get their voice heard is important. They highly valued taking part in this study to get their voice heard. They also recommended patients could be asked to fill questionnaires in surgeries or going door to door as the old-fashioned to get their voice or views. Here are some of the lessons we learned from undertaking this work. So involving community members in research is important. The 3 community-based researchers we recruited in this study played a significant role. They helped with the recruitment. So all participants, they recruited participants to take part in the focus groups or interviews they undertook. And they gained informed consent from participants they recruited. And they collected the data involved in the data collection. So they conducted each of them facilitated focus group discussion, and one community-based researcher also conducted an interview. Then there are some of the issues needed to be considered. First is the sufficient time and the resources. First is the sufficient time and resources required for community engagement, especially with the non-English speaking participants. So, for example, additional resources such as translation, interpretation fees, and transcribing should be considered properly and costed. So then although we had links with different community groups, but we felt if we had more time, So we could spend more time with different, develop a rapport with different, a wider range of local community groups. Then respect the cultural and religious background of participants. So we are unable to arrange a focus group discussion with community-based researchers as we planned. So this was mainly because we found it out one community-based researcher was a Muslim woman, and it would not appropriate for her to attend a group discussion where a male participant may be present. So then, lastly, researchers needed to be adaptable. For example, a Bengali woman wanted to participate, but due to her language barriers, so she requested to have a one-to-one interview, so rather than taking part in a group discussion. So this was considered and facilitated. So these are some of the lessons we learned. Then, so in this small pilot work, so the issues around the waiting time and the need for more inclusive services are highlighted. So the opportunity for residents to have their voice heard is important. However, the need for taking action to address concerns raised is considered crucial to gain trust and ensure ongoing engagement with local communities. It is always challenging to involve community members, especially those from marginalized communities, in service development and research. So meaningful community engagement can be achieved through establishing a long-term trust relationship with local communities. So this would require considerable time, resources, compassion, and effort. Thank you very much. So should I stop sharing?
Juping. Yes, that's lovely. Thank you. Just a big thank you again for presenting this work, Juping, and a big thank you to yourself and Dr. Wallace, obviously, for doing the work in the first place. As you mentioned a couple of things, so if anybody wants to read the bulk of the findings and some of the recommendations that Juping has highlighted or kind of pointed to just now, you can visit www.nightingale.org/activities. We'll put this out in the email that goes out to participants afterwards. The full report that is being summarized by Juping fantastically is available there. And also just to kind of point out, how do we take questions? So if you've got any questions now, we've got about 15 minutes or so left. Please put them in the question answer box, which should be on the webinar meeting control bar at the bottom. Some of you have managed to identify this already kindly when I'm pointing out that the webinar had already started. So thank you for that. But feel free to drop in any comments or any questions for Juping and Dr. Wallace. I suppose while people are just considering if they've got anything to ask or to add, Juping, what would your personal reflections be reflecting back to this work you did? What was it like engaging people and building up those relationships and trust to begin with?
Yeah, thank you. It was not an easy task because the people needed to know you before they're engaged. So it was we approached the various people because for this specific project we needed to target the people who are the users of the health wellbeing center, so restricting those two areas. So we had some links with the different communities in the area, but due to the tight timeline and it wasn't an easy task. People needed to know you. I went to some of the community group, like a Alway Community Center, talk to people. Because people don't know you, they are very less likely to be engaged. I would say it's important to establish a long-term trust relationship with the communities if you want to engage them in any future work, either service development or research. It's not like a one-off. You go to talk to people, you're expecting people to help you to be engaged. It's a long-term partnership.
Thank you. So we've got our first question from Kate Hammond. Thank you, Kate. She's said, Juping, Dr. Wallace, excellent work. How many of the recommendations were implemented, and how has that been shared with the participants? But before I hand across to Professor Wallace and Juping, I'll just say, so the work has only recently been published. It was an independent piece of academic research. I think it's fair to say with the centre only recently opening and all the local services going through a lot of changes in recent months, I think we're still trying to figure out how do we share these findings and build on them. I suppose just to build on that question though, Juping, what would your, and Professor Wallace, what would your reflections be on the kind of risk of not following up in the recommendations in terms of kind of keeping trust with people, that they feel their feedback is valued?
Juping, do you want to go first?
It's like any research, we make recommendations, but there are lots of practical issues, how the recommendations could be implemented, the feasibility and the practical issues as well. So we haven't, it's still early stage. We can, finished this piece of work by the end of last year. So yeah.
Do you want me to come in there, Juping?
Yeah.
I think it would be fair to say that the report needs to be digested by yourself, Johnny, and your colleagues. But also, this is one of the first ways in which we can disseminate findings out to a wider audience. But then there needs to be some conversation as to how now do those researchers, those community anchored researchers, as they were called within the report, how they then can help us in order to disseminate the findings out, because they've been an integral part of the development of this piece of work, and without them, surely we wouldn't have had access to the community. I mean, Juping, and also I must say, also Professor Roy Saltus was involved in this. Without those community anchored researchers, we wouldn't have been able to get to understand the real issues that people face and what they want from the centre.
Thank you.
And also, this is a pilot work. The main focus is on how we can engage those community members to involve in other people in the communities. So the main focus is to see how this would work, how we could engage people, community members, to engage other community members. So there, if we want to get the wider views, we need, seeking more funding to get the wider views, get more people involved. So I would, this is just a small piece of work. We involved in 3 community-based researchers to gain the other views from other community members. So it's a pilot work.
That's great. There's quite a few questions now. We'll try and get through all of them. So we've got a question from Emma Davis McIntosh, who said, I don't know if it's worth yourself, Juping, respond to this one. Did the lay researchers receive any payment or other incentive to conduct the research?
Yes. So we costed for their time, just not the appreciation for their time and the contribution. We costed for each person's in line with the government patient and public engagement and involvement standards, the £25 per hour. So we, that's what we offered in line with the government guidelines.
That's great. Thank you, Juping. The next one could take some answering. Dina Moti's asked, how long, in your opinion, is long time engagement? Is it important that this is done by the same individuals over time? I don't know if yourself, Professor Wallace, or yourself, Juping, wants to answer this one.
I mean, long time engagement. I mean, this was a short piece of work in other areas where we're using community anchored researchers. For example, in the HDRC in Torvine, that's over a period of 5 to 6 years, where we've got funding to be able to do that, to involve them in the development of the health determinants research collaboration. So I think long time engagement's a piece of string, really. How long is a piece of string? How long have you got funding for? And hopefully the engagement is always, because as members of the public, we should always be involved and have an opinion on how our public services are being developed. And I would hope that we would all have a voice in that. Long-term engagement it should always be happening. We should always be funding for it, and we should always be engaging with our members of our community to find out how they want to use our services, and how we can change them going forward to ensure that they are engaging. One of the examples that they gave within the report was, well, people don't turn up for appointments. Well, why is that? So the more we get to know the reasons why by engaging with members of the public, the more likely we are to reduce the number of those people who are not engaging, not taking up their appointments when they've made them. So I think, is it important that it's done by the same individuals over time? We're always going to get turnover, but it's about developing a community of local engaged researchers, and so that we're all working together. And I think that's important, that you have that local community, that you can, maybe you've got turnover, but you can create that momentum and keep that engagement going.
Thank you, Dr. Wallace. That's great. Kate Hopkins has said, were the participants given a comprehensive overview of the purpose of the Health and Wellbeing Centre before they responded? A lot of the suggestions relate to a community centre rather than health and wellbeing. I suppose just building on that, I think it's clear, Juping, that a lot of the questions were focused on the GP practices, really, weren't they? And I just wonder if that was a difficult thing to kind of raise with participants, that we're trying to kind of think about services in a more holistic sense. Was that a kind of an issue that you encountered at all?
And each participant, before when they went for the discussion, I prepared a list of the services. At that time the center was not running yet, because last year a list of services to be delivered. So we asked them, these are the services, because the health and wellbeing center, not just the medical services, and other wellbeing services as well. So we asked their views on not just the focus on the medical services, but on the services that have been provided by the health and wellbeing center.
Thank you, Juping. That's great. If you've got any last burning questions, we can try and fit in one or two more. There's a comment from Suzanne Maddox, just talking about, I suppose, the kind of different organisations that are working in the east of Newport, Ringland and Alway. We've obviously got an NHS facility, the 19 Hills Health and Wellbeing Centre. Next door to that is obviously the adjacent community hub, if colleagues aren't aware, that is run by the local authority, which does function a little bit as a community centre, kind of community hub. But Suzanne kind of rightly points out that probably a lot of the findings would have been well established for some time, that a community development approach is needed, engagement is important. This is clearly bread and butter for the third sector. But I suppose just a personal reflection as a GP, I think the NHS, certainly in primary care and the NHS in general, has probably got a long way to go when it comes to kind of community engagement, community development. I think there's some great examples of this that the health board has obviously leaned into in terms of the Integrated Wellbeing Network programme. We've got a kind of big programme for government in Wales around social prescribing. So I think we are going in the right direction, but you know, as has been pointed out, this is a long-term continuous thing that needs to be part of the mainstream of how we plan not only services in Ringland, Alway and Newport, but in Wales and the UK as a whole. Just to wrap up, I suppose, a question to yourself, Professor Wallace or Juping. This has obviously been a piece of work that couldn't have been done without academic, you know, university support. Where would you like to see or potentially like to see this kind of taking things further? And I suppose as a general point, what would you see the value of an academic partnership to kind of you know, place-based working, for instance, what we're doing in 19 Hills?
Carolyn, would you like to?
Yeah, of course. I mean, we always welcome, we love to work with people, because actually we can't do research without people like yourselves, Johnny, who invite us into your workplace in order to try and solve those hard to solve problems that you've got, and that's what we're there for. You know, research is about trying to resolve those issues that you can't do on your own, and certainly we couldn't do on our own anyway. So we look forward to taking this work forward. I know Juping has been doing some work with Welsh Crucible on the role of the community researcher, and as I mentioned, there's other work ongoing as well. But I think from an All Wales perspective, there's probably a lot more work ongoing, and it'd be lovely to draw it all together to understand what the roles are out there, who's doing what, and how that can translate into using it on a regular basis within healthcare. As you said, you know, maybe healthcare, NHS a little bit behind on. You know, it's been used. I'm trying to be very careful here, as you can imagine. You know, some areas are far more have been using this approach far more than others, no doubt, and some sectors far more than others. But wouldn't it be great if we were all invited to have an opinion on the developments going forward? And I think, you know, things like how we run our primary care services, how we run our wellbeing centres, how we engage with our communities in order to improve our wellbeing. Well, the answers are not just with the services themselves, but actually in the community. And I think, you know, going forward, it would be great if we could have an All Wales approach on that.
Thank you so much, Professor Wallace. I think that's probably us starting to run out of time. We will be sending out a recording of the webinar, as I mentioned, afterwards. If you've got any other questions, please feel free to give us an email at info@19hills.org. We can see if Juping and Professor Wallace can answer them separately. If you would like to follow the activities of 19 Hills CIC, you are free to join our website, like us on Facebook. We do have a podcast program as well that you're welcome to listen to on Spotify and other kind of major podcast platforms. The Community Health and Capital podcast at 19 Hills. Otherwise, we look forward to sharing with you another webinar shortly. There will be more updates going out to Eventbrite, so feel free to follow us there. Thank you so much for joining. I hope you managed to get some rest and break and a chance to eat something in your lunch break. I would look forward to connecting with you very soon. Many thanks. Bye all.
Thank you.
Thank you.